Vaccine math is showing one shot plus one shot equals better protection. Now, Johnson & Johnson is part of the formula. Until now, the only data on it was as a single-dose vaccine.
Shortly after that study was launched, there was already a discussion about should you get 2 doses of J&J product as opposed to only 1.
Tim Schroeder is founder and CEO of Clinical Trials and Consulting, CTI. They worked on both 1 and 2 shot studies, enrolling about 600 people locally.
Not surprisingly, I think, to most people, but giving a second dose of the J&J vaccine about 50 to 60 days after the first dose resulted in an increase in neutralizing antibody against COVID-19.
Every study that reveals one set of answers seems to open up new questions. In this case,
do any of the vaccine products offer any advantages over each other? And I don't know that we're going to have a really strong answer to that, maybe for more than a year or two.
In the new study, J&J jumped efficacy from about 74% with 1 shot to about 94% with 2 shots, ending similar to Pfizer and Moderna 2-shot vaccines. The information will end up with the FDA.
They may take this information and update the label and put more information, say certain groups might benefit from 2 doses rather than 1, or they may come back and say, we don't think that's warranted.
Now the FDA will have to make the calculation to determine if providing a second dose of J&J adds up to change.
Yeah, now part of the information was on a more traditional booster as well, given 6 months after the original single shot. That found that it boosted those antibody levels 12-fold. Now the FDA will have to take a look at this. The J&J has not said yet exactly when they'll release that to the FDA. Reporting live, Brian Hemrick, WLWT News 5.
And what will this mean for people who already got the J&J shot?
Yeah, actually, that gets a little tricky because it could make a case for boosters being given to J&J, the folks who got J&J, but there are a lot of calculations to consider here, and they pull in different directions. Certainly is something the FDA will probably take a look at, but it could end up like Pfizer, where they advise giving the booster to certain groups specific to what may need them. Ashley?
All right, Brian Hemrick reporting live for us. Top to bottom on this story. Thank you, Brian.